Tracey Jedrzejek. I am a lactation consultant in private practice, and I mostly work in the San Francisco Bay Peninsula. And I am honored to have helped Pooja start this new business with newmom.me. I think it's an amazing resource that makes it so easy for moms to get all the support they need in one place and no charge to moms. And I think you're going to help so many new moms in the area, and I'm really excited about the new company. Time today, so I'm just going to give you a general overview of some of the common and not so common breastfeeding issues. I do go into more detail about all of these things in my book, Latch Baby. This book is available on Amazon. So the things I talk about today are not a substitute for medical advice, and it's best to work with a lactation consultant if you're having any challenges, like I mentioned. So the first challenge that I'm going to talk about is sore nipples. This is extremely common for most new moms who are breastfeeding. It's very common as you get used to this frequent breast stimulation that you're not used to. Your skin is not used to that. Your skin can get chafed and sore. Most moms breastfeed 8 to 12 times in a 24-hour period, so it's definitely something to get used to. If you have mild soreness, that should resolve significantly by the baby's 2 weeks of age. And if it is not improving and it is extremely painful right away, I would recommend getting help as soon as possible, because if you don't get help, you'll continue to get more and more sore, and you may get to the point where you can't breastfeed because of the pain. So it's best to get help as soon as possible. The main way to avoid soreness is obtaining a deep latch. And people don't really know what that means, because a lot of times people don't see moms who are breastfeeding, and they may see babies who are bottle fed. And so they see the tip of the bottle going into the baby's mouth. And so they think that when they breastfeed, it's similar to the tip of the bottle. So, but that would be, the baby just getting onto the nipple, which can be extremely painful. So we say it's breastfeeding and not nipple feeding. So it's really important that when the baby latches on, they take as much of the breast tissue as possible in their mouth. They may or may not be able to get their mouth over the whole areola. The size of areola varies widely by different women, but the idea is you want your baby to have as big as mouth as possible when you're trying to latch the baby. As I mentioned, significant pain with latching is not normal and should be addressed as soon as possible. Lots of lactation consultants are not doing home visits right now. I'm doing some occasional home visits. But virtual visits have been surprisingly helpful. So I encourage you to seek out help if you need that during this time of our pandemic. So the next thing I want to talk about is engorgement. And engorgement with breastfeeding is a large increase of milk volume. People sometimes say, do I have any milk? And right when they have their baby, I certainly sent my husband out to the nurse because I squeezed my breast and I expected that milk was going to shoot across the room. And I said, quick, go tell the nurse I don't have any milk. So, that's very typical. You've had milk since the second trimester of your pregnancy. And the delivery of the placenta actually tells your body to increase the milk supply. And then with continued breast stimulation, your milk supply will increase. So, the reason why it's actually a pretty low volume initially for the first 4 days is so that the baby gets used to coordinating a suck, swallow, and breathe pattern. They have been sucking in utero, but they're not used to doing it with air. And so the volume is very low to help them learn that process before day 4, which is typical day when your milk supply increases in volume. A lot of people refer to this as my milk coming in, but lactation consultants don't like that, because we don't want people to think that the first 4 days that you have no milk. And a lot of people will tell me, well, of course I don't have any milk. And I say, no, you have colostrum, and it's really important, the baby doesn't need a bottle, just breastfeed. So, so it's typically occurs on day 4 for your first baby. Your breasts may feel very heavy. Often it's like day 4, you wake up and you feel like just this really heavy feeling on your breasts in the morning. They may feel warm. Some women even get a very mild low-grade fever. And you may feel some lumpiness, especially under your arms and around the perimeter of your breast. So your milk, you have these little sacs that fill with milk that go all the way around the perimeter of your breast. And then they follow through the ducts to come out through the nipples. The nipple, which has, approximately 10 holes. So you might think like a bottle nipple has 1 hole. Well, your nipple has about 10 holes of milk to flow out of. So some people might call me on day 4 and say, I think I have a plugged duct, because they feel that lumpiness. And that's not a plugged duct. A plugged duct is something different that I'm going to talk about later. So it's really just kind of large lumpiness feeling farther back around the perimeter of your breast, and especially under your arms. Excuse me, the best thing you can do is to continue breastfeeding frequently, at least every 3 hours from start to start of feedings for most moms and babies. And you should resolve within 2 to 3 days. Some things you can do to help treat it, or you can use warm compresses before feedings, and that will help to loosen up the milk. One thing that works really well is if you put very warm water, run it in a disposable diaper, because it really helps contain it. And then you can put it onto your breast on the side that you're about to feed on. And you can leave that there for 10 minutes or so, or if you have that luxury before your baby wakes up. But any amount of time of warm compresses before the feedings help the milk to flow during, if you're experiencing engorgement. And then afterwards, we like to use cold compresses, because that's, it's kind of like swelling, it's kind of like if you had a sore ankle or something, you want to use cold compresses after feedings to help reduce the swelling. And bags of frozen peas or corn work really well. You want to have 1 layer of clothing underneath that, and then just put the, around where you're feeling it. And like I said, this typically resolves within 2 or 3 days. My babies were both breastfeeding fairly regularly, so I never really experienced, I did experience an increase in volume, but I didn't experience engorgement where I felt extremely full. And it really just depends on each mom and baby, but it's short-lived, and that's some ways that you can treat it. So, one of the main problems people call me about is difficulty with latching. People assume that breastfeeding should be natural and easy, and most people, like Pooja, don't do any breastfeeding education, get any education before. They're much more worried about the crib and, fixing up the nursery, which is extremely fun, I have to admit. But really, if you can educate yourself, purchase my book, which is extremely short. By the way, I wanted to just show you, the book is full color with very short little paragraphs, lots of tables and pictures. It's only 120 pages. So I just want to show you how easy it is. It's perfect for reading when you're pregnant, or, for looking things up after you have your baby. But anyway, back to that. So I want people to know that breastfeeding is a learned skill for both mom and baby. It's probably not going to happen right away. It's really important to work on getting that deep latch like I talked about. If you're having difficulty latching, you want to get assistance from a lactation consultant as soon as possible. And if your baby isn't latching after about the first 12 hours, it's really important for mom to protect her milk supply, because that regular stimulation tells your body to keep continuing to make the milk. And so if for some reason your baby's not latching, you would want to use a electric breast pump to pump your breast about every 3 hours for 15 minutes to protect your milk supply. If your baby's not latching in the hospital, they often will get you started using a hospital grade pump, pumping regularly to protect your milk supply. And those are also available for rental if you go home and your baby still isn't latching. Of course, the main thing is to feed your baby. So if your baby's not latching, you will be pumping and then giving your baby a bottle, or using a syringe, or lots of other ways that a lactation consultant can help you. So, milk sitting in your breast, if you're not pumping, tells your body to reduce the amount of milk needed. And your milk supply will eventually dry up without regular stimulation. So that's why if your baby isn't latching regularly and you're having to supplement it all, it's really important to pump anytime your baby gets a bottle. The next thing I want to talk about is plug ducts and mastitis. These are pretty rare actually, but I just want to mention them. A plug duct feels like a little hard lump under the skin, and it's quite small. It's about the size of a pea. It can be very common in moms who have an abundant milk supply. And moms often get a plug duct if there's a change to the demand or schedule. Like for instance, if your baby sleeps longer at night than expected, you may wake up with a plug duct. Some moms are more susceptible to them than others. I never got one. Like I said, it's often moms who have an abundant milk supply. They can also be caused by wearing too tight of a bra, like a sports bra, or wearing a bra with underwire. So we typically recommend avoiding underwire bras during breastfeeding. The treatment includes a warm compress and circular massage directly over the lump before feeding or pumping. And that's to try to kind of loosen it up so that hopefully during a breastfeeding session or while pumping, the plug duct will move through the duct and out the nipple. It may come out quite thick. Sometimes we say it's almost like string cheese because it's kind of like hardened milk that's been sitting there. And so that's why sometimes it's hard to move out. And it's perfectly safe if your baby ingests this while breastfeeding. Some other ways are to address it. You can use an electric toothbrush right over the lump, and the vibration kind of may help to break it up. If that doesn't work, there's actually chiropractors that can use ultrasound that helps to break it up, similar to the way you use electric toothbrush. So I refer a lot of moms to local chiropractors who do that. There's also a mineral called lecithin, and that is a mineral that can help resolve plug ducts, and it also helps prevent plug ducts. It's something that you would take, I think, 3 times a day. If a mom gets a plug duct, I typically teach her how to treat it. If she gets another one, then I recommend her starting to take a lecithin supplement regularly every day until she finishes breastfeeding, because it helps to just thin out the milk just a tiny bit. It won't affect your baby's weight at all, but excuse me, it helps to just thin out the milk just enough to help prevent plug ducts. A plug duct that's not resolved can turn into mastitis, and mastitis is an infection of the breast. Symptoms include like a low-grade fever, body aches and chills. You may feel like you're getting the flu. You may feel a red spot or see a red spot on your breast, or soreness on one or both breasts. And the first thing we recommend usually is to get in bed with your baby and just try to breastfeed really frequently. Take your shirt off, have your baby skin to skin, breastfeed a lot, and sometimes it will just help resolve it. And if it's not resolved after 24 hours, unfortunately, you will need to get a prescription for antibiotics, and you would get that through your obstetrician or gynecologist. If you end up having to take antibiotics, I always recommend taking a probiotic during and after the antibiotic treatment, maybe for about a week after, because the antibiotics kill the good bacteria in your body as well as the bad. And so it's really important to replace that, and it shouldn't have any effect on the potency of your antibiotic. This also helps to avoid thrush, which is what I'm going to talk about next. So thrush is it's like a yeast infection on your nipples, and it's quite rare, but some moms get it. Typical symptoms include sudden burning and itching on the nipple. It's similar to a vaginal yeast infection, and moms who are prone to vaginal yeast infections will sometimes get a thrush. And it's basically an overgrowth of yeast on your nipples and areola. Your nipples may look kind of pink or red, irritated. Like I said, you might experience itching and burning. That's kind of the telltale sign of a thrush. And you may see white patches on your baby's tongue and inner cheeks. That is, the symptoms that babies get if they do get it from mom. And if you try to wipe off the milk, like from the inner cheek, if you think it's milk and it doesn't wipe off easily, then it's probably thrush. Moms can have thrush even if their babies have no symptoms. And it's important that both mom and baby are treated for thrush, even if the baby doesn't have any symptoms. So if you suspect that you have thrush, you can call a lactation consultant, or you can call your pediatrician and tell them what your symptoms are. And there's medicine for both mom and baby, and they both have to be treated at the same time. During the treatment time, it's really important to sterilize your pump parts and any bottles you're using daily throughout the treatment to help kill off any yeast that's on those parts. Thrush can often happen if mom had antibiotics during the birth, or after having antibiotics for mastitis treatment, like I mentioned. So if you're breastfeeding and you have to take antibiotics for any reason, take a probiotic at the same time, because you may be, setting yourself up for getting thrush, and you want to keep an eye out for that. I want to give everybody my email address just in case anyone has questions. I'm happy to help. I'm happy to answer easy questions over email, or I'm happy to see you in your home or virtually. My email address is Tracey with an EY at traceylactation.com. That's all I have for today.